Welcome to our comprehensive guide on understanding treatment approaches for human infections. Infections are caused by various microorganisms such as bacteria, viruses, fungi, and parasites. Each type of infection requires a specific approach for effective management. In this video, we'll explore the different strategies used by healthcare professionals to diagnose and treat infections and how these methods have evolved over time. By the end, you'll have a clearer understanding of why certain treatments are chosen and how they work to restore health. Let's begin by looking at what infections are and why they matter. Infections can be caused by a variety of agents, including bacteria, viruses, fungi, and parasites. Each of these microorganisms invades the body in different ways and can lead to a wide range of symptoms. For example, bacteria are single-celled organisms that can multiply rapidly, while viruses need to hijack your cells to reproduce. Fungi and parasites have their own unique life cycles and methods of causing disease. Understanding the type of infectious agent involved is crucial, as it guides the choice of treatment and helps prevent complications. Accurate diagnosis is the first step in treating any infection. Healthcare providers use a combination of patient history, physical examination, and laboratory tests to identify the cause. Blood tests, cultures, and imaging studies can help pinpoint the specific microorganism responsible. Rapid diagnostic tools have improved the speed and accuracy of identifying infections, allowing for quicker and more targeted treatment. Early and precise diagnosis not only improves outcomes, but also helps prevent the spread of infectious diseases. Antibiotics are powerful medicines used to treat bacterial infections. They work by killing bacteria or stopping their growth. However, antibiotics are not effective against viruses, fungi, or parasites. Choosing the right antibiotic depends on the type of bacteria and its sensitivity to certain drugs. Overuse or misuse of antibiotics can lead to resistance, making infections harder to treat. That's why doctors carefully select antibiotics and monitor their use to ensure the best outcomes for patients. When it comes to viral infections, antibiotics won't help. Instead, doctors use antiviral medications. These drugs target specific steps in the virus's life cycle, preventing it from multiplying and spreading. Antiviral treatments are available for conditions like influenza, HIV, and hepatitis. The effectiveness of antivirals often depends on starting treatment early in the course of the illness. As research advances, more targeted and effective antiviral drugs are being developed to combat a wider range of viruses. Fungal infections require a different approach. Antifungal medications are designed to kill or inhibit the growth of fungi. These drugs come in various forms, including creams, tablets, and intravenous solutions, depending on the severity and location of the infection. Some fungal infections are superficial, affecting the skin or nails, while others can be serious and involve internal organs. Prompt and appropriate antifungal therapy is essential to prevent complications, especially in people with weakened immune systems. Parasites such as protozoa, worms, and lice can cause a range of infections. Antiparasitic medications are used to target these organisms specifically. The choice of drug depends on the type of parasite and the part of the body affected. Some treatments are single dose, while others require longer courses. Preventing reinfection is also important, often involving hygiene measures and sometimes treating close contacts. Effective antiparasitic therapy can quickly relieve symptoms and prevent complications. Beyond medications, supportive care plays a vital role in treating infections. This includes rest, hydration, nutrition, and managing symptoms like fever or pain. In severe cases, hospitalization may be needed for intravenous fluids, oxygen, or even intensive care. Supportive care helps the body recover and can make a significant difference in the speed and completeness of healing. It's an essential part of any treatment plan, regardless of the type of infection. Immunotherapy is an exciting area in infection treatment. It involves boosting or modifying the body's immune response to fight infections more effectively. This can include the use of monoclonal antibodies, vaccines, or immune modulators. Immunotherapy is especially important for infections where traditional treatments are less effective or when the immune system needs extra help. Ongoing research is expanding the possibilities for using immunotherapy in a variety of infectious diseases. Vaccines are one of the most powerful tools in preventing infections. By training the immune system to recognize and fight specific pathogens, vaccines can stop infections before they start. Vaccination programs have led to the eradication or control of many serious diseases, such as smallpox and polio. Staying up to date with recommended vaccines is a key part of personal and public health, reducing the spread of infectious diseases in communities. One of the biggest challenges in infection treatment today is antibiotic resistance. This occurs when bacteria evolve to survive exposure to antibiotics, making infections harder to treat. Overuse and misuse of antibiotics in humans and animals contribute to this problem. Combating resistance requires careful prescribing, completing prescribed courses, and ongoing research into new drugs. Public awareness and global cooperation are also essential to address this growing threat. Personalized medicine is changing the way infections are treated. By considering individual factors such as genetics, immune status, and the specific characteristics of the infection, doctors can tailor treatments for better outcomes. This approach can help avoid unnecessary side effects and improve the effectiveness of therapy. Advances in technology and diagnostics are making personalized medicine more accessible and impactful in the fight against infectious diseases. Sometimes, a single medication isn't enough to treat an infection. Combination therapy involves using two or more drugs together to increase effectiveness, prevent resistance, or target different aspects of the infection. This approach is common in treating diseases like tuberculosis, HIV, and certain fungal infections. Combination therapy can be more complex but often leads to better outcomes, especially in difficult-to-treat cases. In some cases, surgery is necessary to treat infections. This might involve draining abscesses, removing infected tissue, or repairing damage caused by the infection. Surgical interventions are usually combined with medical therapy to ensure complete recovery. Advances in surgical techniques have made these procedures safer and more effective, helping patients recover faster and with fewer complications. Preventing the spread of infections is just as important as treating them. Infection control measures include hand hygiene, use of personal protective equipment, sterilization of instruments, and isolation of contagious patients. These practices are essential in hospitals and clinics to protect both patients and healthcare workers. Effective infection control reduces the risk of outbreaks and improves overall patient safety. Nutrition supports the immune system and helps the body fight infections more effectively. A balanced diet provides the vitamins, minerals, and energy needed for recovery. In some cases, nutritional support is provided in hospitals for patients who are unable to eat normally. Proper nutrition can speed up healing, reduce complications, and improve overall outcomes in infection treatment. Staying hydrated is crucial during an infection. Fever, vomiting, or diarrhea can lead to fluid loss, making it important to replace lost fluids. Oral rehydration solutions or intravenous fluids may be used in severe cases. Proper hydration helps maintain blood pressure, supports organ function, and aids in the elimination of toxins from the body. It's a simple but vital part of infection management. Managing symptoms like pain, fever, and discomfort is an important part of infection treatment. Medications such as acetaminophen or ibuprofen can help reduce fever and relieve pain. Other supportive measures like cool compresses or rest can also make patients more comfortable. Symptom relief doesn't cure the infection but helps patients feel better while their body fights off the illness. Regular monitoring and follow-up are essential to ensure that infection treatment is working. Doctors may repeat tests, check symptoms, and adjust medications as needed. Follow-up visits help catch complications early and ensure that the infection has been fully resolved. This ongoing care is especially important for serious or chronic infections. Treating infections in children requires special care. Their immune systems are still developing and they may respond differently to medications. Dosages are carefully calculated based on age and weight. Some infections are more common or more severe in children, making early diagnosis and treatment especially important. Pediatricians are trained to address these unique needs and ensure safe, effective care. Older adults are often more vulnerable to infections due to weaker immune systems and other health conditions. Treatment may need to be adjusted to account for age-related changes in the body and potential interactions with other medications. Monitoring for side effects and complications is especially important in this group. Providing tailored care helps improve outcomes and quality of life for elderly patients. Pregnant women face unique challenges when it comes to infections. Some infections can affect both mother and baby, and not all medications are safe during pregnancy. Doctors carefully weigh the risks and benefits of treatment, often choosing medications that are proven safe for both. Preventing infections through vaccination and good hygiene is especially important during pregnancy. People with weakened immune systems, such as those with HIV, cancer, or organ transplants, are at higher risk for infections. Treatment may involve higher doses, longer courses, or additional medications to prevent complications. Preventive measures such as prophylactic antibiotics or antifungals are often used. Close monitoring and specialized care are essential for these vulnerable patients. Some infections become chronic, lasting for months or even years. Examples include hepatitis B, HIV, and certain fungal infections. Managing chronic infections often requires long-term medication, regular monitoring, and lifestyle adjustments. The goal is to control the infection, prevent complications, and maintain quality of life. Advances in medicine have made it possible for many people with chronic infections to live full, active lives. New infectious diseases continue to emerge, challenging healthcare systems worldwide. Examples include COVID-19, Ebola, and Zika virus. Rapid response, research, and development of new treatments are essential to control outbreaks. Public health measures such as surveillance and vaccination play a key role in preventing the spread of emerging infections. Fighting infections is a global effort. International organizations, governments, and healthcare providers work together to control and eliminate infectious diseases. Initiatives like vaccination campaigns, improved sanitation, and access to medicines have saved millions of lives. Continued collaboration and investment are needed to address ongoing and future challenges in infection control. Telemedicine has become an important tool in infection management, especially during pandemics. It allows patients to consult with healthcare providers remotely, reducing the risk of spreading infections. Telemedicine can be used for follow-up visits, monitoring symptoms, and providing education. This technology is making healthcare more accessible and efficient for many people. Antimicrobial stewardship programs aim to optimize the use of antibiotics and other infection-fighting drugs. These programs promote appropriate prescribing, monitor resistance patterns, and educate healthcare providers and patients. Stewardship helps preserve the effectiveness of existing drugs and reduces the risk of resistance, ensuring that treatments remain effective for future generations. Public health agencies play a crucial role in preventing and controlling infections. They track outbreaks, provide education, and implement policies to protect communities. Public health efforts include vaccination programs, sanitation improvements, and emergency response to epidemics. Strong public health systems are essential for reducing the impact of infectious diseases worldwide. Simple steps at home can help prevent infections. Regular hand washing, safe food handling, and keeping wounds clean are effective ways to reduce risk. Staying up to date with vaccinations and seeking prompt medical care for symptoms are also important. These everyday habits protect not just individuals, but also families and communities from the spread of infectious diseases. Travel can expose people to new infectious diseases. Before traveling, it's important to check for recommended vaccines and take preventive measures, such as using insect repellent or drinking safe water. Being aware of local health risks and practicing good hygiene can help prevent illness while abroad. Travel medicine specialists can provide personalized advice for staying healthy during trips. Some infections are transmitted from animals to humans, known as zoonoses. Examples include rabies, Lyme disease, and certain types of influenza. Preventing these infections involves avoiding contact with sick animals, using protective measures, and vaccinating pets. Public health efforts also focus on monitoring and controlling animal-borne diseases to protect human health. Infections acquired in hospitals, known as healthcare-associated infections, are a significant concern. These can occur after surgery from medical devices or through contact with other patients. Strict infection control practices such as hand hygiene and sterilization are essential to prevent these infections. Hospitals continually monitor and improve their protocols to keep patients safe. Ongoing research and innovation are driving advances in infection treatment. Scientists are developing new drugs, vaccines, and diagnostic tools to stay ahead of evolving pathogens. Clinical trials test the safety and effectiveness of new therapies. Investment in research is essential for finding better ways to prevent, diagnose, and treat infections in the future. Educating patients about infections and their treatments is vital for successful outcomes. Understanding how to take medications, recognize warning signs, and prevent transmission empowers patients to take an active role in their care. Healthcare providers use clear communication and educational materials to support patients throughout their treatment journey. Dealing with an infection can be stressful and impact mental health. Anxiety, depression, and isolation are common, especially during long or severe illnesses. Support from healthcare providers, family, and mental health professionals can help patients cope. Addressing mental health is an important part of holistic infection care. Recovery from a serious infection may require rehabilitation. This can include physical therapy, occupational therapy, or other supportive services to help patients regain strength and function. Rehabilitation is tailored to individual needs and can make a significant difference in long-term outcomes and quality of life. Access to infection treatment can be affected by cost, availability of medicines, and healthcare infrastructure. Efforts to reduce costs and improve access are ongoing, especially in low-resource settings. Health insurance, government programs, and international aid play important roles in making treatment available to those in need. Ethical issues can arise in infection treatment, such as prioritizing limited resources, ensuring informed consent, and balancing individual rights with public health needs. Healthcare providers and policymakers must navigate these challenges with compassion and fairness. Open communication and ethical guidelines help ensure that treatment decisions are made in the best interests of patients and society. Future of infection treatment is promising, with advances in technology, personalized medicine, and global cooperation. New therapies, rapid diagnostics, and improved prevention strategies are on the horizon. Continued investment in research and public health will be key to overcoming current and future challenges in infection management. Hearing from patients who have overcome infections can be inspiring and informative. Their experiences highlight the importance of timely diagnosis, effective treatment, and support from healthcare teams. Patient stories also remind us of the human side of medicine and the impact that infections can have on individuals and families. Communities play a vital role in preventing and managing infections. Public education, vaccination drives, and support for those affected by illness all contribute to healthier societies. Community involvement strengthens public health efforts and ensures that everyone has a role in fighting infectious diseases. Misinformation about infections and their treatments can be harmful. Common myths include the idea that antibiotics cure all infections or that vaccines are unsafe. Addressing these misconceptions through accurate information and education is essential for effective infection control and public trust in healthcare. Sum up, treating human infections involves a combination of accurate diagnosis, targeted medications, supportive care, and prevention strategies. Advances in medicine and public health have greatly improved outcomes, but challenges like resistance and emerging diseases remain. By staying informed and working together, we can continue to make progress in the fight against infections. Thank you for joining us on this journey through the world of infection treatment. Understanding the different approaches helps us appreciate the complexity of managing infectious diseases and the importance of prevention, early intervention, and ongoing research. Stay proactive about your health, follow medical advice, and support efforts to control infections in your community. Together, we can build a healthier future.